Namaste and welcome to the next lecture of Clinical Ayurved. Myself, Dr. Mayuresh Agte. We have discussed Pandu in detail and I have given some different dimensions according to the Kalpa which to be selected in the Pandu Valley. Hope you have understand and if you have any queries, please let me know. So let us go ahead with the next disease of Prattavasotas, which is again a very commonly seen and it is known as Kamala. Now, Vividhan Kaman Lati ite Kamala, where different desires are broken down or patient doesn't wish to have any desire, it is called Kamala. Again, a disease of Rattasotas and mainly the organ, as you know, which to be considered is the Mulavha Sotas of Mulasthana of Ratta Sotas and it is Yakrut. We come across two types of Kamala, Bhupitta Kamala and Ruddhapatha Kamala. In Bhupitta Kamala, there is Pitta Vruddhi and that increased Pitta Prakop spreads all over the body and with the Sanchay Prakop Prasaravastha, and that's why whole body becomes yellow colored according to, and it is called as Bhupitta, where stools as well as urine is also dark yellow colored. And in Ruddhapatha Kamala, it is obstructive jaundice, where there is obstruction in the bile tract, and that's why it is the pitta which is formed in the yakrut is regurgitated all over the body, and that's why there is clay color stool, but otherwise yellowness all over the body including urine. So in Bhupitta Kamala, again here like Pandu, you have to deal with the hetu first, whether it is a bad food products, especially Dushita Jala or any habit like alcohol, or many a times, especially in the chemotherapy or in the treatment of tuberculosis, any side effects of the medicine where the liver is being affected. So let us discuss Bhupitta Kamala first. Liver is damaged and the proper functioning for the liver, you have to make the drugs which will act on liver as well as you have to reduce the increased pitta. Now when you come to these two factors you have to deal with at the same time, that it should be of the liver tonic as well as uh, it will reduce the pitta. The two main rasa which come across, तित्त कशामधून आर पित्त शामक रस, but कषाय रस, तित्त कषाय रस and madhur ras you have to deal with. In that case, firstly, madhur ras is also a good pitta shaman, you know, but when you are using madhur ras, always think of that whether body is able to digest the madhurasatmak dravya, because many a times there is Yathani Mandya you have seen, you see in these patients, and that's why the Madhur Rasa use is indicated, but you have to, like sugarcane juice is indicated in the text, but you have to take care of that whether Jatragni is properly in position. Same with the Kashayaras, that it is also Pitta Shamak, but it is also heavy for the digestions. Hence, the ras which I prefer in my practice in such cases is Tikta ras, because Tikta ras is Jatragni Amapachak. By Laguruksha Guna it will ignite the Agni. Tikta ras itself is a very good liver stimulant rasa, and hence in my opinion, Madhuras, yes, it is indicated. Kasharas you can use on, but Tittaras you can use freely without any uh, without any special precautions. Hence, you will find In the Kamala Chikitsa, you will find the drugs like Guruchi, like Kadechirai or Kirat Pikta, Bhumyamlaki, Musta, Patol are very very useful in the regular clinical practice. So this Tiktaras will help to make the liver in normal state, as well as it will reduce the pitta which has been increased in the body. Now when you are using Tikta Rasa, in which form you can use? Of course, Churna is good, no problem. You can use the Dravya or Kalpa like Sudarshan Ganavati, Mahasudarshan Kwat, Amrutarishta or Bhumyanlaki Kwat or tablets of Bhumyanlaki which are available in the market. Hence, in my opinion, in Bhopitta Kamala, Tiktaras will be more better as compared to Madhur and Kashaya Ras. If Agni is in proper condition, then you can add Madhur Ras like explained in the text, sugarcane juice or Dravya like Yashti Madhu, etc. So, in this case, in Bhopitta Kamala, liver stimulant drugs or liver tonic to the liver are very very important, because the liver is the organ where this nirmiti of excessive pitta is being created. In Uddhapada Kamala, liver is in position, but just the obstruction in the pathway of the bile, it creates the problem of the regurgitation of pitta, and we see Kamala. Now, my question is, if a patient is coming to you, two patients are Kamala with you, one you can diagnose clinically asking that if you have a yellowish discoloration of the skin, eyes, yellowish urine, as well as yellow color stool, you can easily diagnose that it is a Bahupitta Kamala. But if a patient is showing symptoms of yellowishness all over the mucosa, skin, eyes, urine, and asking about the stool, if he says no, the stool is clay colored, then you can also diagnose it as it is a Rudrapada Kamala. My question is, how you will diagnose that where this exactly obstruction is? How will you diagnose that patient's symptoms are of Rudrapada Kamala, but you have to know whether the obstruction is in the bile duct or bile duct is obstructed by some external element. How will you diagnose this avrodh janya samprapti? The avrodh is in the bile duct or external to the bile duct, and it is compressing the bile duct. Homework for you, and we will meet in the and discuss this point and other points of Kamala in the next lecture. Thank you very much.